how has the field of cardiothoracic surgery evolved during your career?
Yeah. Most of it is that. It's that going less invasive as much as possible. So, and there's a couple different angles, but mostly we're talking about valve surgery. So people have aortic valves or mitral valves that wear out. And is there a way we can fix those valves without doing open conventional heart surgery down the middle? So it went to minimally invasive, and now it's catheter based. And that's really the kind of primary focus outside of arrhythmia, which is a whole nother bombshell of an area of cardiology and cardiac surgery would be electrophysiology. So we'll talk a little bit, I'm sure, about this company, Pulse, I've been working with, but atrial fibrillation is a massive problem in the country, or it's a very prevalent disease. 3 to 5 million people in the country have it. A large percentage of people will get it. If you live long enough, there's a pretty good chance you'll have some atrial fibrillation. Well, within the last couple of years, there's been a paradigm shift of the energy that we use to treat it, meaning it used to be a really hot burn or a really cold freeze, and now we've gone to these electrical zaps, more or less. So there's high jolts of electricity to treat the problem, and that's one of the most exciting things I think in the last, certainly in AFib world in the last 10 years that we've had is how do we treat atrial fibrillation faster, safer, and hopefully more effectively without some of the potential consequences or side effects or even complications that could arise with the old methods.
Well, how do you get AFib and how do you try to prevent it?
Yeah. So atrial fibrillation, it's not too different than coronary disease. It's, some of the main causes, genetic, you're just kind of stuck. You can't prevent it, right? But high blood pressure, obesity, sleep apnea, uncontrolled diabetes, those are all things that can stress the heart. And anything that can stress the heart can theoretically put it into atrial fibrillation. Atrial fibrillation, just a heart beats like this, upper chamber, lower chamber, boom, 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 boom. In AFib, the upper chamber just starts fibrillating, and the lower chamber might go fast or it might go irregular, but you have all these electrical circuits that are basically cascading around the heart, and they shouldn't be doing it. The reason is because of those factors we said, whether it's the high blood pressure, sleep apnea, whatnot, they put back pressure on the heart, which causes a little bit of scarring and then causes these electrical short circuits to happen that shouldn't happen. So what can you do to try to prevent AFib? It's kind of the same thing you can do to just be healthy in general. Watch your weight, watch your blood pressure, try to exercise. I'm kind of a everything in moderation guy because I don't think we need to cut out every aspect of life. Right. I mean, alcohol is actually a big contributing cause of AFib, but I wouldn't want to tell everybody in Napa you can't drink alcohol.
Is wine alcohol? I mean,
I don't
when
know.
they talk about wine,